for joining our physical activity peer call for the month of May. My name is Melissa McNeely with APHA, and I also serve as the Peer Learning Network Manager with the Plan4Health project. Today we're excited to be joined by Zarnaaz Bashir. She's our special guest, and she joined the National Recreation and Park Association in October 2009 and is the Vice President of Health and Wellness. She's responsible for shaping and leading the vision of NRPA's health and wellness portfolio, which includes overseeing programs that work to reduce chronic diseases and build healthier environments through parks and recreation, identifying new partnerships, and stewarding existing relationships in health and wellness, and seeking fundraising opportunities. Prior to joining NRPA, Ms. Bashir worked at the National Association of County and City Health Officials as a Senior Program Manager for Public Health Preparedness. She oversaw grants from the Centers for Disease Control and Prevention's Coordinating Office of Terrorism Preparedness and Emergency Response to support local health departments' readiness to respond to public health emergencies and other disasters. Previous work experience includes completing a fellowship with the American Cancer Society to develop and conduct a needs assessment to evaluate cancer services for the poor and underserved populations in Prince George's County, Maryland, and at the American Lung Association of Northern Virginia to implement anti-smoking and asthma maintenance programs in area elementary schools and evaluating those programs as well. Ms. Bashir received her Master's of Public Health from the George Washington University School of Public Health and Health Services with an emphasis on health promotion and disease prevention. Over the years, she has contributed to various journals for publication, including Child Obesity, the Journal for Public Health Management and Practice, and the Journal of Community Health. So today, I'm going to hand it over to Ms. Bashir to lead us in this discussion. And when she's done, please feel free to chat any questions that you may have in the chat box or ask them. Thank you so much. And Ms. Bashir, I'll leave it to you.
Great. Hi, everyone. Thank you, Elizabeth and Melissa, for inviting me to join this call. I'm a big fan of the American Planning Association, and we have a wonderful working relationship with you guys. So I'm also a fan of the Plan4Health project, so happy to be chatting with all of you. Can you hear me okay? Okay. All right, so I was asked to speak a little bit about what we're working on at the National Recreation Park Association with regards to park and rec agencies and connecting them to public health and their role in public health. As you heard in my introduction, I've been with NRPA for several years now, and my background is in public health. So my job has been to link our members, who are local park and rec agencies across the country, local and regional parks, with national public health initiatives and movements. So our health goal, our health and wellness goal, is to improve healthy communities through park and recreation agencies. And we do that in a number of ways, but we're specifically looking at increasing opportunities for people to access physical activity, as well as improving access to nutritious foods through parks and recreation. A lot of people don't know that park and rec are the second largest feeder of kids, for example, just after schools, through their before school, after school, and summer programs. And so we do a lot of work around nutrition as well. But all the work that we do really looks at that health in all policies type of lens. We're talking about health equity and ensuring that all people have access to park and rec services and facilities. We know that people that access our park and rec agencies often are low-income background, of different racial and ethnic groups, different age groups. And so everything that we do, we look at our programs through that equity lens. We're also we really value coalition building, a lot of the work that you guys are doing, that park and rec agencies can't be building healthy communities alone. You need to be working with local leaders and partners, planners, developers, decision makers, schools, businesses, hospitals. That's what we encourage among our membership. And then, of course, we're looking at high impact projects. Programs are fantastic and they're essential. but we're in this movement around policy and systems change and changing the built environment. When I started 6 plus years ago, our agency was really focused on working with different sporting groups and providing sports equipment to our members, and that's what health was all about. And today it's all about healthy vending policies and community gardens and creating more walkable and bikeable environments, working with hospitals. So I've been really pleased to be part of that movement to create more high impact, healthier communities through policy systems and environmental change. And so that's a little bit of background on kind of where park and rec agencies are in the public health world. We're seeing a greater recognition in the public health world as well as the medical community that park and rec agencies really do provide health benefits, physical, mental, spiritual, with individuals. So that's really nice to see, but honestly, we have a long way to go. You know, I live in a community where there's a local health coalition that's run by the health department. I sometimes sit in on their meetings, and you have nonprofits there, you have the hospitals there, the sheriff's department, but park and rec department is not at the table. And, you know, it goes both ways. I think the health department is not fully understanding what the role of the park and rec agency, what they play in health and wellness. And then I know that the parks department is also just very overwhelmed and not thinking about, you know, let's be part of this local health coalition and be doing work together with our community partners. So, you know, there's a gap there, and that's what we're trying to work on here at NRPA is really promote that awareness across communities. And so through our work, there's, you know, obviously many different areas that we can be working on, but what I'm going to talk about today are our three main program areas that may be of interest to you guys, or in the work that you're doing, you might already be seeing this happen. And I know APA, also we partner with them on Safe Routes to Parks. So that's one of the projects I'm going to be talking about, Safe Routes to Parks, and then park prescriptions, and then Commit to Health. I think you have a slide up on the screen, and these are, I'm just sharing some visuals, but Safe Routes to Parks is an initiative that started a few years ago when we were working with the CDC on play deserts, and we were looking at helping our members and others understand how they can measure and identify play deserts in their community. And that's, you know, spaces, it was specific to kids, but we can broaden that to other groups as well. But where are we lacking access to physical activity opportunities in the community? And we're talking about parks, of course, when NRPA is talking about play deserts, but that's not just whether a park is there or not. It's, is the park there? And if the park is there, can you access it? And if you can access it, is it of good quality and well-maintained? And then if you can access it and it's well-maintained, are people actually using it? Is there good programming and supervised activity that people actually want to go to the park? And from there, we had our wonderful Surgeon General that released his call to action on walking. And so with that call to action, as well as our play desert work, we initiated this Safe Routes to Parks campaign in which we are building awareness among our membership that access to parks is essential. And so what you see up on the screen are a few of the resources that we've developed for our members, infographics, videos, a publication on what it means to have a safe route to a park. And so up there you see the 5 essential elements. We did some focus groups with our members to identify, you know, through their work, what are they seeing as the 5 essential elements to get people to safely walk to their parks. And those were, you know, safety, is it properly lit, convenience, are they living within a 10-minute walk? The research shows that it's really that half-mile proximity in which people will actually walk to the park. Access and design, is it properly designed, especially for disabled people as well as older adults? The conditions of the route to the park, sidewalks and trails should be inviting and comfortable and safe for all users. And finally, the park itself. I mentioned this earlier. Are the facilities and amenities and programs at the park reflective of the needs of the community that they actually want to go and visit the park? They're not going to access the park if they don't even want to go there in the first place. And so what we're doing with Safe Routes to Parks, we have a great partnership with APA, Trust for Public Land, and also the Safe Routes to Schools National Partnership. We are developing a policy framework right now, and we're going to be gathering some experts at the end of June to identify what are some of those key policies and strategies for a community to implement in order to be a safe route to a park. And we're hoping to have that ready to go this summer. How do I switch the slide? Do I just, oh, did it. All right, so that's Safe Routes to Parks, and I'm happy to answer any questions about that. We have some stories that we've collected as well. Another very, very hot topic right now is park prescriptions. We've been working on this since 2012, actually, and it began with our work with the CDC. And it is exactly what it sounds like. It's doctors prescribing wellness at the local park. It works really well. We just released a survey to our members, a small sample of our members, I should say, about 6 weeks ago, and gathered quite a few robust programs from across the country to identify or understand what their successes and challenges are, how many healthcare providers they have working on their program, how many patients they've seen, how they are evaluating their programs to ensure that it's actually making a health impact. And we just released a website about 3 weeks ago, parkrx.org, in collaboration with the National Park Service and the Institute at the Golden Gate on the West Coast, as a resource to people who want to learn more about this, people who want to create a park prescription program or talk to others that are working on this. If you know anybody in your community that's doing this type of work, I would encourage them to go to that website. We're hoping to develop resources and toolkits, but also a newsletter to keep people informed of what park prescriptions is all about. And it really does work well, especially when you have that physician champion in the community that's a big nature advocate and loves parks, and they're waiting for their parks to reach out to them to create that kind of relationship where they can refer their patients to an evidence-based program or a walking program at the park, and there has to be that kind of closed loop communication where they're hearing back from the park and getting feedback on how their patients are actually exercising at the park. Those are the ones that tend to work really well. So that's a little bit about park prescriptions. And then finally, Commit to Health is probably one of our biggest programs. It's been getting a lot of support from funders. And this goes back to what I said earlier about feeding kids. This is a program that's implementing healthy eating and physical activity evidence-based standards in local park and rec agencies during out-of-school times. And so these are evidence-based standards that were created by a group of people a few years ago. We work very closely with the Partnership for a Healthier America and the Alliance for a Healthier Generation, and it's things like serve a fruit or vegetable at every snack or meal, or serve only whole grain rich products, or dedicate at least 30 minutes of morning or after school program physical activity and at least 60 minutes for a full day program, limit screen time. In fact, it actually says do not permit screen time. They're pretty rigorous. Ensure that physical activity takes place outdoors. And so these are standards that we've been implementing for over a year now, and we already have 999 agencies already signed up to do this. So this is a huge movement, and it's about policy change and implementing standards in a sustainable way, so we're very excited about that as well. And so those are our three kind of key programs right now. We do a lot of work in other areas like particular chronic disease type programs like arthritis, but these are our general focus areas at the moment. And so I'm going to stop there. I think I probably talked longer than my 10 minutes, and I will see if anyone has any questions. Elizabeth, how do you want to handle the questions? Are they just supposed to chat them, or?
Sure, that would be great. Feel free to chat questions, or it's a small enough group, I think, that if you'd like to unmute your line, you're welcome to ask a question directly. That was fabulous.
I would love to hear if anyone on the call is actually working with Park and Rec agencies and how they're doing that.
Sure.
Hello.
Hi.
Hi, my name is Basha Kalkan. I'm actually an urban designer with a private firm. And this is wonderful work and wonderful resources that I wasn't aware of. So thank you for sharing.
Absolutely.
Some of the work we've done with Park and Rec agencies involves pulling them into coalitions that we've brought together for health districts. Recently in Baton Rouge, we pulled together 13 healthcare, academic, and research organizations into a new health district, and Parks and Rec Department was a big part of the conversation around some of the physical planning for the future of the area. And we were trying to work with them so that the Parks and Rec Department could have the easements it needed for trails from the hospitals. So that was a specific example. My question for you is, you mentioned that you work a little bit with hospitals, and I was wondering if you had any specific examples other than maybe the park prescription programs.
Outside of park prescription programs, or did you say within park prescriptions?
No, outside of.
You know, most of the work that we are doing is through our local communities, and they are through a park prescription model. I know that there are some of the community health needs assessment types of work that are going on, which the hospitals are developing their community health plans, and some of those are working in conjunction with the Park and Rec agencies or have involved them. And we're in the process of looking at what that has involved, but I won't be able to speak on that currently. But in terms of that linkage, we have our magazine that goes out to our members, 50,000 members, and I just finished writing an article about healthcare providers and their perceptions of parks. And I talked to nurse practitioners as well, not just doctors, but they were cardiologists, pediatricians, and many of them, you know, while it might not be the actual prescription model, like literally writing a prescription or giving their patient something that says go to the park, a lot of them are doing things like walking with their patients in the park. In Montana, there's the Kaniksu Land Trust, and the nurse practitioner there. She walks with 20 of her patients every Sunday at the park.
Wow.
And yeah, and there's a Walk with a Doc program that was developed by, are you familiar with that one?
Yeah, it's a great program.
Yeah. So there's a lot of those that aren't actually a prescription model, but there's the connection there. And then, as you mentioned, these coalitions, I've seen some of those local health coalitions that have that are being led by the Park and Rec Agency and the health department, but they've involved their hospital systems as well.
That's great. These are great resources. Is the magazine going to be available on your website, or is it just for members?
You know, I would be happy to share that with Elizabeth, and it's going to come out. It's our June Health and Wellness issue, so it'll be in early June available, and I'd be happy to share that with you.
That'd be wonderful.
It comes digitally, so I'll share the online version.
Thank you.
Thank you.
We did receive a chat from the team in North Carolina. So near Charlotte in Mecklenburg County, that coalition is working to include the County Parks and Recreation Department, and they're really focusing on inclusive design and access to parks.
Wonderful.
And this comment mentions that they would love to do a park prescription program maybe someday, so this has been a great presentation and certainly helpful thinking about kind of next steps and where to go.
Awesome. Well, I see that you shared parkrx.org in the chat group. I would encourage that person to sign up so at least they're on the email list, and that way they can get the latest information regarding park prescriptions.
Great. Any other questions or comments while we have a few more minutes in our call time? Melissa, did you have any thoughts or comments you'd like to share?
I thought it was a great presentation, and I'm very impressed with all of the work being done in the 3 programs. I honestly didn't know that that Parks and Recs were so involved with feeding children and making sure they have, nutritious food, which is fabulous, and all of the coalition building and the partnerships, the health and all policies, and the PSE approaches. It's great to hear that you are really focusing on such different approaches, which are very similar to a lot of the work that's being done by our Plan4Health coalitions as well.
I have a question about that. Of all of your grantees, are many of them working with Park and Rec agencies?
So we have a couple of folks in our new cohort. Cohort 2 started in November, and they're really hitting the ground. We just had our technical assistance and training workshop a couple of weeks ago. We have a couple of sites who are thinking about trails and connectivity with trail systems, and then a couple of folks like the North Carolina team where they're really working on park access. In cohort 1, we also had the folks in Columbus, Ohio are working on the Greenways initiative there, and you may have connected with Scott Ulrich at the Walking Summit at one point. I feel like you might have been on a panel together, actually, now that I'm saying this out loud.
Yes, we met. Great work.
So,
he's doing
yes,
some good
no,
stuff.
it's been fabulous. And actually the team in Pierce County, Washington, just released a really interesting trail study. Of course, it was done before Plan4Health, but thinking about ways to really connect the entire watershed there. So there are a few folks in the physical activity side who are thinking about parks, and then I think your point about nutrition was a really, really thought-provoking one. I think that statistic about how many children are relying on Parks and Rec for food and a nutrition source, I think is a really important thing to keep in mind. And not just putting parks in that physical activity box, but really thinking about how it connects across all of our focus areas in Plan4Health.
To be honest, it was an eye-opener for me, too. When I started working here, I was like, oh, I would not have thought of that. And it's not just kids during out-of-school times, but there are also things like healthy vending, healthy concessions, community gardens, farmers markets. Park and Rec agencies are really working in the nutrition space in a variety of ways.
Well, and that prompted a question through our chat box. Are you all doing anything with smoke-free or tobacco-free parks? And I imagine you are.
Oh, great question. And knowing that I was talking to you all, I should have mentioned that. So while I say that our priority areas are physical activity and nutrition, and that's primarily because we're funded that way. But I know a lot of our agencies are working on smoke-free and tobacco-free bans and developing policies. When we were working on a CDC grant similar to Plan4Health, we saw great success in that area. Longview, Washington was one of the sites that we worked with, and they had implemented a tobacco ban across all of their city parks. Recently in Helena, Montana, they also had success around implementing smoke-free parks across their entire park system. I think Arlington, Virginia has done some great work around that as well. And I'm sure there's a lot more. Actually, there are a lot more, but it is a very important area for us. We just don't have a particular program focused on that right now. Thank you for that question, though. It is really important, and it's a big success, especially when you're thinking about public spaces, limiting smoking and banning tobacco. That's just a big win for public health.
Absolutely. We had the Partnering for Health. So Plan4Health is part of a larger national collaborative called Partnering for Health. And our workshop a couple of weeks ago was in New Orleans, where we were celebrating the passage, or I think it was the 1-year anniversary of their smoke-free city, which is fabulous and a huge change. The implementation, I think, is still in the early stages. Not quite smoke-free everywhere, but a huge step, certainly. Well, this has been really fabulous. Thank you so much for your time and resources. We really appreciate it.
Thank you. And I'm happy if you want to share my email with the participants. If they think of any other questions afterwards, please feel free to email me, and I'm happy to share anything with you.
Fabulous. Thank you so much.
All right.
All right.
Well, thanks, everyone. Have a great day.
Thank you. You too.
Thank you.